Welcome back, everybody. I'm Dr. Zeke, pharmacist and adult sleep coach, and today we are going to talk about an important topic as it relates to women and hormones, especially their monthly cycle. Today we are going to talk about how progesterone can be lower than expected, almost leading to symptoms of what's called estrogen dominance, and why that can affect your sleep. So if you're interested in something like this, stay tuned. For the next 10 minutes, we are going to be talking about the cycle as it relates to after day 14, which is ovulation, where we come to a critical point where progesterone starts to peak and estrogen starts to follow it. So this is the first time in the cycle where you have both of them. And therefore, when something is wrong, like you low progesterone, you can find issues. So today we're going to talk about the progesterone and its natural rise. We're also going to talk about what does progesterone do and why is it so important for our sleep. Then we're going to start talking about what can actually cause your progesterone to be lower. A lot of women after birth control, after children, or very demanding and stressful jobs really deal with low progesterone or what's called estrogen dominance. And then we're going to talk about symptoms of low progesterone or the estrogen dominance and long-term effects of that. And then we're going to also look at hormone testing. How can we really break this open and find out what's going on? Because as you will find out, serum lab testing, which is blood draw, is not the best way to look at active hormones that are affecting your body. So this is a slide that I like to go over. This little critical period after day 14 is when progesterone starts to rise and estrogen starts to follow it. You'll notice between day 19 and 23 of your cycle that progesterone and estrogen should be at a good ratio of one another, and therefore allowing you to feel the effects of progesterone. But when you start to have progesterone lowering and estrogen staying the same or potentially higher, you start to get things like estrogen dominance. Now, this balance is so important because if you don't have a balance, let's just quickly look at what happens with just progesterone in general. I'm looking at this slide here, and you can automatically see when it comes to sleep and brain health, progesterone has extremely positive sedative effects as it relates to the body, therefore helping us sleep and staying asleep longer. So you should be having better sleep after about day 18 of your cycle leading up to your period, when progesterone really takes a big fall. Now, it also is an anti-inflammatory. It prevents anxiety and irritability and mood swings. It also promotes myelin sheath, so it protects you from autoimmune diseases and things like that. It helps to balance estrogen. So if you have low progesterone, estrogen symptoms can just be so erratic at times, so severe, so intense. It obviously aids in ovulation, helps maintain pregnancy. But if you look down where it says reproductive health, it affects the potentiation of GABA. And the GABA receptors in our brain help us calm down. And certain progesterone metabolites help to trigger that GABA receptor and really help us feel more sedative. So you oftentimes hear, if you're going to take progesterone for sleep, you want to take it at night because it can have a very sedative effect. Here are so many more things on why you want to have optimal, within a range progesterone. So just go over these by yourself. I'm not going to really fall too much and just really go into them, but let's talk about what are the causes of progesterone deficiency. So when you look at it, there's certain antidepressants that we can take. These are more old school antidepressants that can affect your progesterone levels. You have hypothyroidism, so your hormones have to be in balance. It has to be in balance, not imbalance. And therefore, when something is off, you can oftentimes find that there's an issue with everything else. But I want to really highlight the 4 down here that are highlighted in blue. You have deficiencies in vitamin A, B6, C, vitamin C, and zinc. These are important minerals because when you are deficient in those, we cannot convert active hormones or substrates of hormones to progesterone, and therefore you have a much lower amount in your body. Now, when I'm looking at deficiencies, I'm looking at individuals with poor diets. So for example, high sugar intake, the amount that your body has to do to really kick out sugar really depletes us of nutrients, whether it's because we're going to the bathroom all the time, like peeing, or You just have so much that your liver has to take care of this, and then your kidneys. So you really deplete a lot of nutrients when that happens. So if you think about vitamin A, B6, C, and zinc, a lot of those go with everything else. Now, when you think about saturated fat intake, you're really looking at those really unhealthy foods, eating out a lot, the fried foods, the things where you're using a lot of that vegetable oil type stuff, soy oil. So those are some things that you really want to watch out for. And then lastly, in big bold letters, stress. Individuals that are highly stressed in their work, in their family, in their social life will notice a depletion of sex hormones. Your body has two choices. It can either make stress hormone at that time, or it can rebuild the foundation of your sex hormones, which is your progesterone and your estrogen. If you don't give it that calming sensation, that wind down, those breaks that you need, your body will constantly stay in overdrive and focus on cortisol rather than progesterone. So stress is huge. Now, what are some of the symptoms? As you can tell there, mood swings, irritability, anxiety, decreased libido, so not feeling the urge to wanting to have sex. You have insomnia, because remember, progesterone helps you calm down. And when you don't have that calming factor, estrogen is more stimulating, right? It's more arousing. So you will sometimes have more restless sleep, harder to fall asleep, and you might find yourself waking up earlier and really not having that calming phase in your cycle to prepare you for when your period is about to arrive. So these are some of the common symptoms of low progesterone. Look at them at your leisure, pause this, take a video clip, whatever you need to do. But let's talk about something that I always like to bring up. What are symptoms of elevated estrogen? Because when we have low progesterone, estrogen will dominate. So you might notice the same thing: depression with anxiety or agitation, decrease in sexual interest, low libido, fatigue. Something that's more pertinent is fibrocystic breasts. You have little lumps that are benign and they don't cause any type of cancer, but they can be real sensitive. They can be painful when you press on them. So you might notice that with estrogen that is elevated. You'll have the mood swings, poor sleep or insomnia, weight gain. So these types of things will oftentimes overlap, and a lot of experts are calling this type of symptom estrogen dominance. So you have more estrogen than what you're supposed to have as it relates to your progesterone. So short term, you might notice a lot of abnormal bleeding, longer periods, maybe heavier flows, very cramping, and you could also notice infertility. Now, one other thing that we do want to think about is long term. What are those increased risks if we don't take care of this? And what we've seen is there's certain autoimmune issues that can occur. Remember what I said, progesterone helps to protect the myelin sheath, and there's autoimmune diseases that affect that part of our nervous system. There's also breast cancer and uterine cancer, because as we know, progesterone balances the effects of estrogen. And when estrogen is too high, what ends up happening is that we have more stimulation to those proliferative sex organs like our breasts, our uterus, our ovaries, and many other things. So it has to be in a balance. Now, when we look at testing, you'll often hear a lot of doctors that are in that functional medicine realm talk about saliva testing. This is a great way for women that are in that menopause state that typically will have lower progesterone, especially if you're looking in through PMS symptoms or any hormonal imbalances. Now, this can help evaluate fertility because you can really do a spit test 28 days to really map out your hormones. But most doctors will just stick to that low progesterone era just to look at that. But we can measure things like cortisol, DHEA, and melatonin, which are many things that can affect our sleep as well. So when you look at this is also the preferred testing if you're applying hormones topically that are absorbing into the bloodstream. So as we mentioned, when is a good time to test your progesterone or find out if there is estrogen dominance? Once this crossroad occurs in your hormones, typically day 19 and 23, if your doctor's just doing some random test, a lot of times that's telling them, A, they don't know what they're doing, or B, you might have irregular cycles. So when that occurs, or you might notice, I don't have a 28-day cycle. Maybe I have a 35-day cycle, and it seems to be pretty normal. Then you might notice doctors doing it later in day 28, because that's where that little rise in progesterone and estrogen, we're trying to capture it right here to find that ratio and to really make sure we are capturing the best representation of what we call the later luteal phase of your menstrual cycle. So when we go to the next thing, this is just what a salival testing lab test looks like. So I'm going to bring my little highlight here. Remember, we have E1 estrone, which is something that's produced by our fat cells and takes over when we go into menopause. Remember, proliferative when it comes to breast tissue and things like that. So is E2, so we want those in balance. And then we have estriol, which is a little bit more protective, but it's not like the best thing ever, right? We want them all in a balance, not too high, not too low. But as we look at this, it gives you this breakdown of progesterone and E2 ratio. And as you can tell in this example, we notice that it is low. We don't want it low. We want it right there in range. What that's telling me is progesterone is low. Estrogen is typically normal range because you have these little green triangles. And that's telling us, okay, we have to do something. Testosterone seems to be in range. And then look here, we have DHEA, a precursor to a lot of our hormones and other things in our body that is at the moment doing really low. So doctors could supplement here with DHEA, progesterone, and take another saliva test to see how you're doing. Now, when we really look at urine testing, this part is important because this measures the downstream metabolites and helps to really break down on what's happening. So one thing that's important to know is when estrogen breaks down into other forms of estrogen, there are certain metabolites that can cause damage in your DNA. It can also ramp up the receptors in your ovaries, in your breast tissue. And so we really want to know downstream what is going on and whether or not your body is detoxing or getting rid of estrogen properly. So this gives you a much bigger picture. And as you can imagine, you typically don't want to overhydrate when you do a urine test. I typically recommend patients to, within day 19, 23 of your cycle, if you have a regular 28-day period, make sure to get the morning pee, right? Like when you wake up, everything's concentrated. You've been fasting for, I don't know, at least 8 to 12 hours. This is the best sample for something like this. And this is what it tells you. So I'm going to bring this up, right? These kind of show you these fancy little dials, right? You have this E2. This green zone is kind of like what's normal with a girl that's not in menopause. This purple zone right here tells you what's going on in menopause, where your range should be. And notice how it's not as high as it is when you're not in menopause. Remember, menopause is when you no longer have a period, your ovaries are starting to produce less and less sex hormone, and you are starting to feel the changes in your body. Now, it also tells us progesterone. And for this individual, we have progesterone in a menopausal or postmenopausal range. So it would immediately tell the doctor, we need to start supplementing with progesterone, especially if this individual is not in menopause or has never had a hysterectomy or anything like that to significantly impact your progesterone. Now, if we go down here, we are looking at DHA production and testosterone. Remember, with women, testosterone is an important hormone, but we don't need too much. You'll start growing face hair, acne, and oily skin, and so many other things. You'll feel like a teenager all over again, and we don't want that when you are 30, 40 years old, right? And so that is an important feature when you look at urine testing. And then lastly, remember what I told you about estrogen metabolites. When I look at estrogen metabolites, 2-OH, you'll see it right here, 2-OH actually is a metabolite that is very protective, and immediately it goes into a methylation form and gets kicked out of the body. So we, in general, do want a good amount of 2-OH estrogen metabolite. But when I look at 16-OH, that is more proliferative. It messes with our breast tissue, messes with the ovaries and other sex hormones, and it causes a stimulation which can eventually lead to cancer. we've seen that it's associated with more cancer. So therefore, we do want to be careful on how much we have. Same with 4-OH. 4-OH has been seen, I believe it's to like damage DNA in our cells, which can eventually lead to free radicals and other things that cause cancer disorders past. And these are all associative. So it's not like we've seen random control trials to show this, but we've just seen it in data where it's like these individuals have cancer and these metabolites are always high, or this ratio is always low. So this individual right here at 11% and 4% are showing that they're producing very little 2-OH, which is the protective amount, and the others, which are the more proliferative, higher risks, are too high. And same with methylation. That's a phase 2, and we'll talk about that next video. But these are so important because when you break things down like this can be so confusing to a lot of us. But remember, we have this 2-OH, which is very helpful. It goes right into methylation, and usually from that point, it gets excreted in the poop, the pee, something like that, right? And then these two, remember I was saying 4-OH and then the 16-OH form. And so what we want to do is typically push towards this 2-OH, and that's exactly what we're going to talk about in our next video. So I know this is a lot of information. Feel free to go back, ask questions down below. I'll do my best to answer them or make you another video to further explain that topic, because for these videos, we can only go high level. Anything too far in detail are just going to be way too long, and it's going to put you guys to sleep, which is typically the best compliment as a sleep coach. So feel free to subscribe, leave a comment, like, share, do anything you can so we can keep these videos rolling for your education. And with that, next time we're going to talk about part 2. What can we eat? What can we do to help detox these hormones to really give our progesterone that we have in our bodies the best chance?